All right, well, we're going to move on to the COVID thing, which I don't want to spend all day on it, but it is topical, I suppose. We now have what appears to be a vaccine.
Yes.
And it looks like it's going to be doled out in doses, and based on people like yourself who are on the front lines are going to get it first, and elderly people, I guess.
Yes.
Can you walk us through how you see that playing out over the next 6 months?
Yes. So as you know, Pfizer was the first vaccine to receive emergency authorization, and the shipments started going out. I think it was Sunday night or something like that. Some of the hospitals have already received vaccine and are starting to administer them. That particular vaccine has to be kept at an extremely cold temperature, and so it can only go to certain places that can accommodate that. And those are a number of hospitals that are set up for that. Individual doctors' offices and pharmacies are not going to be equipped for that, but hot on the heels is the Moderna vaccine, which needs to be kept cold, but a conventional freezer is cold enough. The incoming administration is putting together a comprehensive federal plan guidelines for administering the vaccine, which is something we have sorely needed.
Okay.
And obviously, we need to follow those guidelines. It is anticipated that the first wave, as you've mentioned, will be healthcare workers and nursing home patients. The second wave will be the elderly and people with significant comorbid conditions, and then it'll probably go down the list by age. Being affiliated with a hospital, I do admit patients to the hospital. I'm in the hospital fairly regularly. I will most likely have access to be vaccinated through Advent Health by being on staff there, probably within a few weeks.
Okay.
Which will be nice, obviously.
And a lot of people have reservations, I guess I'd say, about vaccines maybe in general or just this vaccine. Can you cover that for me?
Well, recently, of course, there's the wave of misinformation. But long-term, there's just been a general distrust, mainly due to lack of education by the lay public on these medical issues. One of the things that helped pull us out of the dark ages were not only antibiotics, but vaccines. If you look at your children and the multitude of vaccines that they get and how well they do with all those vaccinations, and no, the measles, mumps, rubella vaccine does not cause autism.
Sure.
You can see that our life expectancy went up directly because of vaccines. If you go back 100 or 200 years, people would traditionally die from mumps, measles, rubella, and all the other things that we get vaccinated for. So we've had a lot of experience with vaccines. When given out amongst millions of people, yes, you're going to see an occasional person that gets a side effect, sometimes maybe even an anaphylactic reaction. But for the great majority of people, vaccines are extremely well tolerated. Not only that, vaccine production and the ways the vaccines are made have advanced significantly. We went from weakened organisms, whether they were viral or bacterial, which were being injected into us. For example, the smallpox vaccine was a weakened smallpox organism. And that worked wonderfully well, but you could still get smallpox from the vaccine on rare occasions. And then we went to, then we had dead particles, dead viral or bacterial material that was injected into us, to then recombinant DNA technology, where you're taking a piece of the DNA strand of the organism and you're coding for that, and the vaccine is made from that. Your body makes an antibody that's specific to that small segment, and so when the organism enters your body, the antibody attaches to that small segment of the DNA it recognizes. And so you're not actually getting injected with any complete part of an organism, so you can't actually get the disease, and that's what a lot of people don't understand. You can no longer get from modern vaccines the actual thing you're being vaccinated for.
I think that's a critical point that most people don't understand.
Right, but when you get a vaccine and you're challenging the immune system, you can feel a little feverish, you can feel achy, you can have some symptoms, and people mistake that for being ill with the organism. Flu shot's a good example. It's impossible to get the flu from the flu shot.
Right.
But you can feel a little flu-like after the vaccine.
Yeah, that happens to my wife for the first night or so. She feels,
Yeah.
but in a few hours it's gone. So.
But the other thing that's happened is something like the flu shot, which of course is trying to cover a variety of different flu strains that keep changing every year, is at best 60% effective. Then the first great vaccine that was developed as far as efficacy is the Shingles vaccine, which came out in 2007 and reached an efficacy of 95%.
Yeah. I think this is critical, especially for older people, right? You gave me my shingles vaccine.
Over the age of 50.
When I turned 50, which was yesterday. You gave that to me, and I didn't really have any side effects. But I think a lot of people don't even realize they can get vaccinated for that.
Yeah, shingles it can be devastating. I've had people with residual pain from shingles for several years that have fallen into depression due to chronic pain. I've had several people get it in their face and eye and end up in the hospital. It can be a very painful, terrible thing, which is preventable. Now that vaccine in quite a few people can make you feel poorly for a day or two.
Yeah.
And I tell people, I felt that way. It's certainly better than shingles.
Yes.
And people are worried about the COVID vaccine and potential side effects. Well, anything's better than getting COVID. I have 3 patients that are currently suffering with COVID out of 35 total that I've had so far, and they are suffering. I have people with ongoing fevers, coughing, shortness of breath, severe hives, and I'm managing those things as an outpatient. None of these people are at a point where they have to go to the hospital, but they could. The point is, the COVID vaccine is something that most of us should really consider taking.
Good. Yeah, I just want to make sure people are watching this have all these misconceptions depending on their flavor of information. So I want to make sure we...
Not to get into too much detail, but the COVID vaccine is an RNA vaccine as opposed to the previous DNA, which does represent a whole nother level of advancement. And again, the first several vaccines that are coming out, the Pfizer, Moderna, and AstraZeneca, are, at least with the initial numbers, they're posting efficacy rates of 97 and 98%, which is unheard of.
That's awesome. And so quickly.
Yeah, less than a year.
Yeah, that's amazing.
Typical a quick vaccine used to take 4 years to produce, and the previous vaccines took much more than that.
Do you think that's the last thing I want to touch on here? Do you think that that's a sign of things to come in terms of when we do face these types of situations, we'll be able to react quicker to them?
Yeah, absolutely.
Yeah.
You have a lot of researchers working on it. You have tremendous computation power, predictive modeling, all sorts of things.
That's great. Well, that's good news for everybody.